Good morning, everybody. Good morning. Welcome to Brookings. My name is Stuart Butler. I'm a senior fellow here in the Economic Studies Division, and I want to just welcome you all here, particularly those of you for whom this is the first time, and I also want to welcome people who are watching us by webcast as well. Here at Brookings, we hold a series of monthly meetings where we bring in a whole range of different people. People who are researchers, policy people, people who are practitioners in multiple fields, in particularly health, education, social services, and we kind of mix them all together in this monthly meeting. It's a relatively small meeting. And what we do is explore areas where better collaboration across sectors, across these different sectors, will actually improve both the medical health and the sort of economic and social health of households and communities. So we're looking at ways to improve that collaboration. And also in so doing to, among other things, address some of the disparities and inequities in the healthcare system, because so many of them are related to these other factors. So for example, we look at areas like successful aging in place, where we know from the research and experience that in order for somebody to successfully and happily age in their own home and safely, then a lot of other things have to work. We have to have effective social services. We have to have safe housing. We have to have effective transportation and so on. So we know that a number of these things are really important. When you look at areas like adolescent mental health, we know that unless the school is talking to the parents and they're dealing with the juvenile justice system in some cases, that child's not going to do very well in life. So we're looking at these areas of where collaboration across sectors is very important. We look at good examples, and the practitioners are often the most effective people to tell us about those, of good examples of collaboration. But we also look at what are the barriers to collaboration across sectors to improve social and health outcomes. And what are the needed policy steps to help improve the environment for better collaboration across these areas. And a lot of things keep coming up in terms of issues that have to be addressed. And one of them, which just keeps coming up over and over again, whatever the topic that we're looking at, is the need to find better ways to enable funds from different programs, including the private sector, to actually work together and to be used together more effectively and creatively to produce outcomes. It doesn't matter really which area you're looking at, that is the case. So we need to find, we recognize from these meetings, we need to find more ways, better ways of bringing greater flexibility and innovation in the use of funds together. And really when you look at this, as we've been talking about it, there are a couple of ways or a couple of approaches to enabling funds to be used effective in this way. One is a term we use, braiding. And braiding means essentially coordinating several different funding streams, including private in some cases, but certainly from different government programs, and getting them to link together in such a way that they can work together, but they are separate funds, and they are separately monitored and measured and evaluated. And one way to looking at this is the idea of braiding, like braiding hair, different strands, as you can see. Now, if you have a teenage daughter, these would be very different colors, very bright colors, but you get a sense of coming from different programs, but coming together and kind of working effectively. That's one way to do it, and that's the most common. A second way would be what we call blending, to actually put all that money in one pot. This is less common, and we'll be talking a little bit about this during the panels, less common, but all the money basically goes into one fungible group and can be used then creatively to achieve the objectives of the multiple sectors, the multiple programs. And one way to think about that is this picture, kind of looking at all these different funds coming through, coming to some intermediary, some body that brings this money together and then uses the pool funds in that way. So given these discussions that we've had in this monthly group, we decided to set up a small working group of people both inside Brookings and outside, a cross-section of the people, kinds of people I mentioned, to explore in more depth the issues associated with braiding and blending funds to achieve common objectives and collaboration across sector, and also to help try to improve and encourage a public conversation, not just among the general public, but particularly among policymakers, about how best to make this happen in the areas, in the sectors that they're in. And so today's event is designed to help do that, to help have a conversation through panels this morning about what are the issues associated with braiding and blending? What do we know? What are the good examples? And how can we make that happen more generally and more effectively to improve the conditions, the health conditions, deal with disparities, and so on in this country? And to start this, we're going to have a short conversation among three of us about some of the issues generally, some of the sort of high-level issues that have to be addressed. We're then going to have a panel of real people who do this in the field, who actually do this stuff. And I know, as somebody who works in a think tank, we'll learn a lot of, probably more from them than from anybody else. And then last but by no means least, we're going to have a panel that's going to look at some of the policy ideas and policy steps, including what's going on, to help improve that policy climate to encourage braiding and blending. So let's get started, and I'm going to ask Kathy Steck and Sandra Wilkins to join me up here on the podium. We're going to have a conversation generally about this issue. Please come up, and you'll be mic'd up in a second. Kathy Steck is now is a consultant, and most recently she was vice president at the Laura and John Arnold Foundation here in Washington, D.C. But in a way, she's on the panel because she spent 30 years in the federal government, and 27 of those years at the Office of Management and Budget, actually overseeing budgets and regulatory issues for a whole range of different agencies, including education and labor and human services programs. Joining her is Sandra Wilkins, and Sandra is program director at the National Governors Association's Best Practices Health Division, where she focuses on exactly these issues related to behavioral health and to social determinants of health, the various elements that come into the equation that affect health. She has had a number of academic positions and was also chief psychologist of the inpatient psychiatry unit at the University of Illinois Hospital. So I'll hand over to Kathy, and I'll join you.
Great. So I just have to say I'm really excited to be here with people from both sectors, health and the non-health social services. So in my time at OMB, I worked very hard in the sort of non-health sector to think about creative ways for blending and braiding, breaking down silos, worked on pay-for-success initiatives and something called performance partnership pilots. But we were never really able to engage the health side of OMB in the same deep thinking. They were involved in implementing the Affordable Care Act, which was really hard. And I had the pleasure of meeting Stewart after I left government, discovering that there's this cadre of health policy experts that are out there trying to improve outcomes and lower costs by reaching over and collaborating with the social services side. So hopefully today will be an inspiring conversation for everybody and get us thinking very creatively. So Stewart, you mentioned that blending and braiding comes up repeatedly in your working groups, and I want you to just take us through why it's so important.
Well, I mean, the root of it is that we know that in order to be successful in really every field, whether it's having a child successfully graduate from high school or somebody to do well in terms of their health, we have to have other elements in play all the time, other factors affect us, and we call these social determinants of health. I actually talk about social determinants of everything because I think whatever sector you're talking about, that is generally true. And as I said at the beginning, it's really important to have the various funding streams work together successfully. So one of the things we've been really thinking about and looked at very carefully is that this is really important in some key areas. I mentioned aging, for example. Unless you have, if somebody's going to successfully age at home, unless you have social services provided to them, unless their home is safe so they're not likely to fall, unless there's good transportation, unless you deal with the issues of loneliness and isolation, it's not going to be successful. So we are trying constantly to look at ways of bringing this together. It turns out, we've discovered in our conversations, that this is easier said than done, that there are a lot of barriers to this. Sometimes different agencies don't easily work together. They're not used to doing that, as you mentioned. Sometimes people who have the lead just are not familiar. We find things like data is often not shared, so we don't actually know across sectors what's going on with people. So in order to look at things like aging in place, you've got to figure out how to do that. And so that means, and this is what really comes up in our conversations, you've got to start thinking about procedures, bodies. What kind of actual procedures do you put in place? What rule changes do you make? What incentives do you put into place to get people who are responsible for money from these different sectors to actually plan together and exchange information and work together? So that's one of the things that we feel really came out of our conversations really important, to think about the structure of government itself and what bodies need to go into place. The second related piece is something that we call, particularly among economists, the wrong pocket problem. And this is kind of arises from the fact that sometimes in order to solve a problem or to improve a situation in, say, the health area, improving somebody's medical situation, it actually makes sense to invest in another sector, say housing. So if you're thinking about reducing the number of falls so that fewer elderly people end up being rushed to the emergency room and then having a very expensive procedure under Medicare or maybe Medicaid if they're poor, it's often best to look, how do you improve their bathroom layout? How do you look at things like nutrition in their home and deal with those? That's somebody else's budget. So what you end up doing, the challenge you have to face, is that often to get a real value added, a savings or an improvement in one sector, you really want somebody else in another sector to do the investing. So they have all the costs. You know, maybe housing, the guy who runs housing is asked to spend more money, and the person who's running the Medicaid program gets the benefit. So this does not compute in most people's minds in terms of how you get this to happen. So we're thinking about ways of addressing that wrong pocket problem. Partly we look at things like how do you induce or how do you change the budget in, say, the housing area to deal with these issues of aging or health. But another way to look at it is how do you make it possible for maybe if the health program, if Medicare and Medicaid is going to benefit from investments in the housing and have savings, maybe Medicare and Medicaid ought to be the programs that actually invest in the housing because they're getting the return. So another issue which is really important that we focus on is how do you look at changing in the health programs particularly, how do you make it easier for them to invest in other areas that have a payoff in healthcare? And that involves often legislative changes. Sometimes you're just not allowed to do that. We're seeing improvement in this area, as we all know. But that's really important. So I think those two areas of how do you set up the structures and then how do you set up the incentives and make it possible for programs to begin to mix up their money more in order to achieve those. Those are the two things I think really come out of our conversations.
Great. All right, Sandra, you focus on state level issues. So what's happening at the state level to reduce the silos and the fragmented efforts at addressing social determinants? And what are you seeing as some of the main obstacles to blending and braiding?
Yeah, thank you. And I'll pick it up with the two important elements that Stewart ended on, which is what are the structures and how do we bring together some of the financing structures. I thought it might be really helpful to talk a little bit about what we've learned in our work with governors and their senior policy advisors through the center on how they're achieving cross-sector and cross-agency collaboration around some real priority areas for governors. And it's actually really increasing. So I'm hoping to provide some opportunities for discussion and to stimulate some ideas about what seems to be working and where is there some momentum and where are some remaining challenges, which Stewart already highlighted some, but I can add a couple at the end of this. And I would say that much of this is still in the braiding space. I think that's probably a fair statement. But I will also say it's really exciting because I think a lot of the cross-sector, cross-agency work is in part driven by appreciation of the value of the determinants of everything. I love that. It's not just the determinants of health, the determinants of everything is really driving a lot of the conversation, which I think is very encouraging. And governors are aware of it, and I think they're taking the lead in establishing some of this cross-sector work. So a few examples I just wanted to hit the highlights on, given the time this morning. Where this is occurring. There are others that we can note, but some of these are really the hot topics going on across the country. And so, of course, a big lesson learned is when it's a hot topic, you capitalize on it and it can really drive change. So a few buckets. Complex care programs, Stuart already alluded to a little bit of this, but in the Medicaid space on the state side, these are the folks that often are referred to as high utilizers of costly services or high needs, high cost populations. There's a lot of cross-sector work going on there, and I'll highlight that in just a couple of minutes. Of course, in the opioids crisis and the opioids response space, there's a lot of cross-sector work. Even outside of health, human and social services, which are implicated in a lot of the other programs I'm going to talk about, and really brings in the public safety and the corrections element, so supply and demand and bringing in the whole spectrum and what's happening there. Children's cabinets, I think, are a really good example of governance structure, and we're going to hear more about those a little bit later when we hear from our second panel what's happening on the local level and perhaps what's happening on the state level around these children's cabinets that allow child and youth serving initiatives to flourish. And these are just in a nutshell, usually on the state level established by executive order or legislation, and are comprised of state agency leads that touch anything to do with children and youth to really think collectively and collaboratively around policy solutions, exchanging information and financing strategies. And then finally, the fourth one I want to highlight is school safety. We know this is such an important topic over the last short period of time, and this also brings together really different sectors to work collaboratively and to think about how are we going to pay for what we want to do to keep children safe, healthy, and successful. So again, public safety, education, and health and human services sectors. So briefly on each of these, in the complex care space, especially in the Medicaid program, states are really doing data-driven work. Looking across health, human services, Medicaid, and social service providers to really understand who are we talking about and how best do we meet their needs in a cost-effective ways that gets people out of acute care settings and institutional settings where, quite frankly, they're not getting good care, they're not improving, and it's really costly to the states. So some examples of how the funding sources are being brought together to address some of those needs are through Medicaid programs, through behavioral health block grants, and really importantly through some of the social services sectors. I think that many of the focus areas are food insecurity, transportation needs, housing and employment supports. Housing is the big one. I know everybody in this room and probably who's listening in today has heard a lot about housing initiatives. And I think that there are a number of states that successfully have brought together their health and housing sectors. It is a real challenge. I point you to a roadmap that we pulled together a couple of years ago at NGA called Housing as Healthcare, that highlights how complicated all of the financing sectors are with respect to bringing in the capital, the operations, and the services supports to really put together a comprehensive housing solution that also provides wraparound social support services. What are governors doing? They're bringing together some of the leaders who often have never talked to each other, Medicaid, behavioral health, the Housing Finance Authority, the continuum of care, and on the local level, the public housing authorities and other social service providers never talk to each other, really big buckets of money that are being invested in these initiatives, and how do we actually think about a successful braiding solution here? And there are a number of states that are doing this. I can point to a few. Louisiana we'll hear a little bit more about later, Michigan and others, and happy to share what some of the details are there. In the opioid space, as you all know well, governors have pulled together many governance structures in order to support the cross-cutting needs here in the opioid space. Opioids response teams, command centers for those states, or some of those states who have had emergency declarations around the opioid crisis, and just work groups. And we've been working with states since 2012 to try to help them organize their work in the opioid space. What is really interesting here, and again, I'd love to give you a lot more detail, but just to hit the highlights, is more recently states are very innovatively braiding together the state opioid response dollars, which are the big federal dollars to address the opioid crisis flowing to states through SAMHSA, SAMHSA block grants for substance abuse services and mental health services, public funds, private investments, philanthropic funds, to really address a whole host of things, including harm reduction approaches across the state, syringe exchange programs, to address housing needs across the continuum of housing supports for people who are housing insecure, people coming out of correction settings. Some states are actually working very closely with their public safety and corrections folks to build out a continuum of supports for people who are moving in and out of the criminal justice system and also have treatment needs around medication-assisted treatment and all the supports that help you sustainably live in the community and stay out of those settings and flourish through those treatment interventions, and again, including housing supports, reconnecting with employment, reconnecting with social networks, and braiding together all those funding streams to do that work. It is, I'm making it sound really simple. It is not. It is tricky, and a lot of it really is the players. A lot of it is, what is the imperative? What vision have we set that is really a clear goal that cuts across all of our sectors, and how are we coming together to break down sort of the cultural barriers to work together around solutions that, quite frankly, have not, are foreign to some folks in different sectors. Children's cabinets, really briefly, again, are governance structures that are on the state level. There are others on the local level too, and I won't get into any of those details there. I'll just highlight what's happening on the state level. There are at least 12, perhaps more, that have established children's cabinets. And I think they're growing. There are a couple of new administrations that are either establishing or reestablishing children's cabinets. And the goal really is, how can we set, on the governor's level or legislative level, a vision around how we want to better improve outcomes for our children's youth and family, to set those goals very clearly, to force some of that cross-sector conversation, and then establish the governance, data, and financing strategies to actually achieve those goals and break down the barriers across the different agencies. We'll hear from Pam Brown a little bit later today about how some of this is playing out in Maryland. A couple of the states, or perhaps more, are actually developing children's budgets, which I think is a really important thing to dig into if you're curious in this area. And that is what it sounds like. They're actually thinking about the budget holistically across all the things they want to achieve around outcomes and indicators for the children and youth in the state, and really trying to think about how are we going to pay for this in a holistic manner. On the school safety side, this is from my perspective, and some of the projects we've worked with state, has been a really interesting phenomenon. A lot of the investment and attention has come in from the Homeland Security public safety side of the equation. How do we really think about creating a safe environment, school hardening, bringing in school resource officers? All of this is so important. How do we bring in law enforcement to really understand where the threats are? What has really evolved over the last year, which I think is very exciting from a braiding and blending perspective, is the education supports and the health and human services supports have come in, and together these three sectors are now saying, okay, we're all working at this in our own silos. We all have actually very similar structures and frameworks to address these issues. How do we work more collectively together? And those conversations are happening. And there are a lot of lightning rod issues that help drive that. In the education side, there's social emotional learning and school climate are really hot topics. On the health and behavioral health side, comprehensive mental health solutions. How do we bring Medicaid into schools to actually make that linkage stronger between community-based solutions and school-based solutions for kids who actually have higher needs? Those are coming together. So we see public safety and corrections dollars, law enforcement involved in this. We see Medicaid dollars and behavioral health block grant dollars, and then of course the dollars that flow through the education system don't come in through the state, but really come in locally through school districts. And how are those being leveraged and braided and blended? And many of those are in some of these initiatives. I think that at this point I'll stop on some examples. I have many more to offer you. And I'll just highlight a couple more challenges to supplement what Stewart has already offered. I think one of the challenges And I think this is on all levels of government that we don't talk quite as much about, is we're trying to break down the silos and defragment the system. And I think there's a real appreciation that these are cross-cutting issues that require not just our own sector's expertise, but what is often happening is the silos are actually bloating and expanding and saying, I can solve this in my lane, rather than necessarily reaching across the aisle. So I think what's really important is the direction, the vision, the leadership, and the requirements to work together to stop looking in your own lane and start reaching across for that expertise. That has been a real challenge, I think, on all levels of government, and is also reflected in how the funds are flowing. And of course, one of the challenges on the state side is with respect to federal dollars that are coming into states, as they're trying to leverage all of those, and certainly in a cross-sector way, there are real challenges with misaligned reporting and accounting requirements. The timing of grants are all misaligned, and so it's very hard to think holistically about bringing in those federal dollars and combining with state and local over a certain period of time to achieve a certain set of initiatives without everything breaking down, because there's that misalignment on the federal side, which I know is a challenge. Similarly with evaluation requirements and so on. Just a couple other things to note, and then I'll stop and turn it back over to you. Stewart already talked about the wrong pockets problem. I think there's some movement on the state part to really think about reinvestment strategies. So even though we still need to do work on the front end around the wrong pocket problem, there's some intentional thinking about if there are savings related to determinants of health on the health side, how are we thinking about reinvesting those dollars in that same initiative, at least in sort of a local microcosm kind of way, rather than doing what we usually do, and it goes back to budget or some other program. So I think there's opportunity to leverage some of that work. And the other thing I would say is there are often, through initiatives, requirements to build governance structures. So what we often see as we're trying to help states work across lines is there are 10 different governance structures that are all sort of semi-overlapping and doing the same thing. And part of what we do at NGA is try to help them sort out, is there one? Are there one or two? And how do we get those to work together? And how do we reduce some of that duplication? So I think there's opportunity to address that challenge as well. And I'll stop there.
That was great.
Thanks.
That was great. So I think we're going to spend the day thinking about effective blending and braiding, but based on your observations, what do you think are the sort of key ingredients for success, so that as folks are thinking about doing this at the state and local level, they know that they've got the right components?
Mm-hmm. Well, I think first of all, it's very important to have legislation and rules that allow and set up these bodies. We've had some significant success at that at the federal level. If you look at the Medicare program, for example, Medicare Advantage now, just because of legislation last year, Medicare Advantage plans can spend money on areas like transportation and others, recognizing that this is crucial to that. We also see in the whole waiver program, the Medicaid program, working with the states, has allowed states to come forward with ideas, with ways of using money differently, and pilot programs as well by the federal government. So I think legislation and federal action is certainly important. I think that figuring out effectively how to do evaluation and monitoring of funds is really important at all levels of government. Once that money is braided or blended together, you've got to make sure that the intent of that program is filled out, is fully accomplished. That can be really challenging. So I think that's a really important area. I think it's important also to figure out at what level of the federal system it's best, or what kind of organizations or bodies are most appropriate at different levels. Maybe at the national level, we're talking more about interagency cooperation, councils and so on. When you get further down the system, you really are talking about, some cases, new organizations, and you'll hear from some of those, designed specifically to bring this money together and to do the record keeping and evaluation. So you've got to figure out exactly where in the system you have a body and what kind of body it should be. And I'd say also a really crucial element is, you'll hear this all the time, is leadership. That unless somebody takes the initiative, who's in a position to be able to make things happen, unless they take the initiative and send the message down to other people that this is how we're going to do things, it's really difficult to see something successfully happening. You can set up a system, but if the governor is not behind it, or if the county executive is not behind it, and makes that very clear and gives the incentives for people to cooperate, it's probably going to fizzle out or not be effective. So I'd say those, to my mind, are really the critical pieces.
Sandra?
Thank you. And I can say, I'll just take up where you left off. What we usually find in our work is successful is what you just said, is the governor provides leadership, both through vision. The governor is the key administrator, purchaser and supplier of a lot of things. So using all of those levers and the bully pulpit where necessary to really demonstrate that leadership and show the commitment to whatever the initiative is really important. I think a few other elements that we find are critical is scanning the environment, knowing what's already out there, and let's leverage that and bring in those stakeholders who are already driving work on a local level or in another state to help really drive change rather than reinventing the wheel is absolutely critical. I think getting the right people to the table, we were talking earlier, but it's all about the people. A lot of this is culture change. A lot of this is taking on new things that that a specific agency's mission or vision has never taken on before. So it's getting together the right people and making sure those communications are occurring, which of course requires information exchange. We all know there are significant challenges with data exchange and information exchange in these really complex areas. And trying to work around or work with some of those challenges continues to be an opportunity. And then I would say really focusing squarely on the delivery and the payment strategies that are needed to drive the change, and using that to help drive some of the conversation and create some of the culture change.
Great.
Yeah.
So have we left anything out?
Well, I would just say maybe a footnote to what Sandra was saying about the community. I think one of these issues that we have in any area of allowing money to be used more fungibly across sectors is trust. You've got to have trust at the local level, that people know that when money that they, from a particular program that is their primary funder goes into another organization in the same community, there's a reason for this, and it's to everybody's benefit. So building up trust and having the right players to build that trust is crucially important. And then I think in thinking about trust, that then I think affects where you make these decisions, who's involved, at what level. It very much affects that. I think we'll hear that these institutions that are closer to the community, that are actually doing the detail of braiding and blending money, tend to be far more trusted than something which is a direction from on high. But I also think the other thing I would say is that constant kind of innovation and testing is really what's important. If there was a simple handbook for exactly how to do this, well, there are some handbooks about how to do it, but if we had a perfect handbook, we wouldn't be having to meet and talk about this. The fact is we keep learning all the time. And so this use of things like federal waivers to say to states, come with your idea about how to look at the Medicaid program, for example, and use that effectively to deal with housing issues that affect the people who are on Medicaid. Using waivers, using pilots. The Center on Medicare and Medicaid Services has been very effective at seeding pilots to try these things. We've got to constantly learn. I think and as you learn, it's really important to have institutions that then spread that knowledge so that others, that's why what Sandra's doing at the National Governors Association is so important. It's not just working with particular governors, but it's telling other governors and other agencies what the lessons have been. That's a really important process, and it's something that we in the working group looking at this have been very attuned to. How can we think about how better to share this information? We're trying to do it, but we think others really have to do this as well.
Great. I just want to make an observation. Certainly in my time in federal government, we often had new administrations come in, we'd have pilots, innovation, and it would be time limited. So, you do something, and then the next guys come in and they have their own ideas about innovation, and whatever you learned from before, there was never a way to scale it. And I think the key on blending and braiding is that when you do innovation, at the same time, you're thinking about how would you actually scale this within your existing funding streams. So you try it, but you have a long-term sustainable path. And
Oh,
you agree?
I absolutely agree, and I think that combined with the trust, that it has to be the people trusting and buying into this in the long term, as well as the braiding and blending, is absolutely critical. Yeah.
So anything else to
No, I
add
think that's-
before
I
we,
think we-
okay?
Let's hear from people who do it.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.